Now, Johannesburg City Power has started excluding certain hospitals and clinics from load shedding. It's to help alleviate the pressure on these healthcare facilities after the South African Medical Association warned of catastrophic consequences. The body's Dr. Mark Human joins us now live. Good evening, Dr. Human. A pleasure to have you with us tonight. Let's talk firstly about the kind of pressure and what you are seeing in hospitals whenever load shedding kicks in.
Yes, thank you, Catherine, and good evening to your viewers. Unfortunately, a lot of the hospitals are not protected against load shedding, and there are numerous structures that are not well catered for by the simple kinds of protection that exists, like diesel generation. For example, and it's been mentioned before, simple things like sterilizing theatre equipment requires very energy-intensive systems, and thus frequently don't survive simple diesel generation backup. Of course, there are many questions to be asked here. The first is, why did it take so long for this idea of protecting our local hospitals in Gauteng to be raised? There's precedent set for some time now in other provinces, most notably the Western Cape. And surely one would think our provincial administration and Department of Health should have the capacity to learn from the successes of some of the other provinces.
I imagine that it has to do with the fact that some of these hospitals have been speaking out about the impact of this, including organizations such as yourself. And I mean, it's very much an indication of where things have come to, that sometimes the only way to get things done is to exert a level of public pressure.
Absolutely. I think that, as you probably are well aware, a petition was started by one of our senior clinicians at the Charlotte Mkeke Hospital and supported and grew very rapidly. There are other campaigning organizations that have been very involved, like the Progressive Health Forum, like SAMA, like the Treatment Action Campaign. And when you hear the same message from multiple voices, I think it's difficult not to heed that message. Of course, once our own health minister got involved, then it seemed like results came quite quickly. At least that's how it looks on the outside. Again, the big question is, where's the capacity at the Gauteng Provincial Department of Health? And why? Load shedding is not a new thing for us South Africans. We've been exposed to this since 2007. One would think that 15 years worth of planning should have led to a lot better backup systems. But that's clearly not the case. And when you realize that your planning was deficient, the most obvious next thing is to approach the energy body and say, we need a free pass, because people basically and simply are going to die if that's not the case.
I imagine that one of the things that becomes even more disheartening is that in the absence of these measures, right, these standby and backup measures that are needed in order to keep saving lives, we then are made aware of, large-scale looting and corruption that is linked to resources of the health department, linked to resources of hospitals. It's really a question of priorities and where the priorities of the department are and how much accountability it's subjecting some of its officials to.
Yeah, look, I think that we're going to open a very large can of worms here, but unfortunately the big state institutions are owned and managed by the Department of Infrastructure and Development. So ask a question, what's happening at the top of the Gauteng Department of Infrastructure and Development at the moment, and why are most of the top or many of the top executives suspended on corruption allegations? These are the people responsible for building and maintaining our hospitals. And this is a legacy we inherited from our previous, government, but really health should be health, and the hospitals should fall under the Department of Health, assuming, of course, that the department has the capacity, which clearly some of our provinces do, but some of them don't. But it would be much easier to maintain and to run and to look after if all of health fell under one simple department.
All right. We're going to leave it there for tonight.